Before we begin, please know that some episodes include language that may be sensitive for some people. Welcome to another episode of The Birth Portal. My name is Connie. Today's true story is about a woman I'll call Salima, that I only met the day she went into labor. Her midwife was in the hospital attending another client's cesarean section when she went into labor. The midwife asked me to go to Salima's home to assess her. This was Salima's first birth, and labors for first-time mothers are on average about 8 hours. She thinks her water broke around 3 a.m., and by 8:30 in the morning she was contracting regularly, but the pains were in her back and only lasting 30 seconds. So I'm thinking there's plenty of time before Salima is fully dilated. So many times we see back labor causing prodromal labors. Prodromal labor is when a woman is contracting but very minimal cervical changes are happening. This can go on for 24 hours or longer, and the contractions are often irregular but disturbing enough that women can't sleep. Some women, they'd end up coming to the hospital for morphine and gravel just to be able to get some sleep so they'd have energy for when active labor kicked in. When I'm on my way to Salima's home, driving in the worst road conditions of the year, the snow is like grease on the roads. Her husband calls and asks me, "Where are you?" She's vomiting now and has lots of bloody show. She's contracting every 3 minutes now. However, the pains were still in her back. So I suggested we meet at the hospital as they wanted a hospital birth. I called the hospital to let them know we are on our way in. I changed directions and head to the hospital. When I arrive, the charge nurse on the labor and delivery unit says she's in room 7 and is really uncomfortable. When a nurse tells you that, you know things are happening. When I walked into the room, Salima's in the middle of a contraction trying to hold the pain inside, stiff as a board. I say to her, "Lean on the bed. Let me put pressure on your back." She lets out a moan and says, "Oh, thank you." Back labor is the worst type of labor a woman can endure. Sometimes relief in that back pain comes when you apply pressure to the lower back during a contraction. If the woman is lying on her back, you can have her knees bent and you kneel in front of her and put the palms of your hands on her kneecaps. Let your body weight lean into her kneecaps. Or have the woman leaning over the bed during a contraction and squeeze her hips inward. Another way to help with back labor is to inject sterile water in 4 pea-sized blister-like bubbles under the first layer of skin at the site of the sacrum. That hurts like getting stung by a bee. But the next contraction, the pain in the back is gone, and this can last up to an hour and a half in my experience. The pain of the contractions must be worse in the back than the front for this to be effective. For Salima, the pressure on her sacrum only worked for that one contraction. She is quickly hit with another contractions, and my efforts are to no avail. "Let's check your cervix, Salima, after this contraction and see what's going on." I listen to the baby's heart with the Doppler, and it's great. Salima has a hard time moving, but is finally on the bed. "Wow, Salima, I feel lots of your baby's hair, and the head is very low. All I feel is a tiny bit of cervix on one side of the baby's head. You are so close to being able to push your baby out. You should be so proud of yourself." English is not her first language, and she says, "Epidural?" I explain that I need to draw her blood, and it will take at least a half an hour to an hour before the anesthetist can come, and I think her body won't make it, and soon she'll want to start pushing to get the baby out. I encourage her to sit on the toilet to try and pee before pushing. We encourage women to empty their bladders regularly in labor, as the bladder is like a water balloon in the pelvis and competes for space with the baby. So if the bladder is full, even partially full, it can impact the ability of the baby to descend into the pelvis. While she is in the bathroom, I quickly set up my equipment, draw up my oxytocin, check the newborn resuscitation area, and call my backup midwife to come. Salima soon comes out of the bathroom and moves to stand at the side of the bed and is struck with a contraction so strong she looks me in the eye in terror. I mouth the words, "It's okay, it's okay," and I mimic sounds for her to make with me. Deep, low groans on the exhale. I shift my weight from one foot to the other, encouraging her to do the same as I look into her beautiful green hazel eyes. After that contraction is over, I leave the room to find a birthing stool for her. When I walk back into the room, Salima starts to make the primal grunting sound. And I ask her if she feels pinching when she pushes. "No, it feels better," she says. Pinching often means that there's still a bit of cervix. We are fully dilated then. Her cousin is by her side and states she has a strong feeling this baby will be born at noon. Salima's mother needed to calm herself and left the room for a cigarette. Salima wasn't waiting for her mother to return and pushed so well, she had her daughter at 11:59 a.m. Salima's midwife was finished with her other client who had a cesarean section and was able to come in and assist Salima in breastfeeding for the first time. Grandma came back to the room and was surprised to see the baby in her daughter's arms breastfeeding. "It took me hours to get the baby out," she says, which was translated by the cousin. She goes to her daughter's side and asks, "Is she okay? What did you have?" Salima has a big smile and says, "It's a girl. Look, she's so beautiful and smart, already breastfeeding." Thank you for joining me for another episode of The Birth Portal.